Okay, so today's video, I just want to talk about the basic principles of dealing with an abscess. So abscesses are basically a pocket of pus in the body, and the most common times we see those are cat fight wounds. So cat scratches and bites have quite nasty bacteria. In dogs it tends to be most commonly from a foreign body, so a grass seed or something sticking in there. Now, the most important thing to understand with abscesses is drainage is essential for treating them, because the body's actually very good at walling off infection. And so if you just treat with antibiotics, the body tends to have the abscess walled off. The antibiotics don't penetrate very well, and antibiotics are quite ineffective with around a lot of organic matter or a lot of pus. And so putting an animal with an abscess just on antibiotics generally means that it'll improve a little bit, but you stop the antibiotics, it flares up again. So the critical thing is drainage, and that may be under anaesthetic. It may be something we can do in the consult room, depending on the type of abscess and whether there's any openings that we can use. But basically, what we'd look at doing is establishing drainage at the bottom of the abscess. So once we've given either an anaesthetic, a bit of sedation, or a bit of local, then we'll look at putting an incision in the bottom part of the abscess, because obviously if we put the drainage hole up here, the fluid can't drain out. So we make a drainage hole in the bottom, allow the pus to come out, give it a really good flush and a clean out, because we want to make sure that we remove as much of the infection as possible. If there's a grass seed or suspicious of a foreign body, we'll do a good search for that. And in some cases we may actually just remove the whole abscess, because if we can't find a foreign body but we're suspicious of it, sometimes a little foreign body might just sit outside the abscess, so it can be very easy or very hard to find it at times and very easy to leave it behind. So really getting rid of that infection is the important bit. We may or may not use antibiotics, because if we can remove a grass seed, for example, establish drainage, we quite often can avoid antibiotics, and ultimately with the resistance coming onto antibiotics, we really do need to minimise our use of those. So that's what we want to aim for any sort of abscess. If you find that your cat's got a soft swelling over its body, if your dog's got swelling between its paws, that's probably an abscess. We need to look at establishing drainage, removing the underlying cause, and they do very well.